So I'd like to start by thanking Carol Herbert and the Canadian Academy of Health Sciences for organizing what I think is a very relevant, very important, very timely day addressing Indigenous health. And I'd like to thank wonderful elder from Kahnawake, Amelia, for opening this morning. We've chosen to start with just one general slide about participatory research, community engagement. And I've chosen 3 key reviews over the last 18 years. The first one documented that using participatory research, engaging with community, built on community strengths and resources. That it's always in this partnership, it's iterative and cyclical. You can imagine the discussions that go on that change the program and improve it and make sure of the relevance, and promotes co-learning and empowerment. The next review showed that it promotes social justice. I think that's easy to understand. For the Indigenous projects that were included in this review, it promoted self-determination. And for all projects, promotes knowledge translation. Not just knowledge translation at the end of the project, but knowledge translation throughout the project. You can understand when there's continuous discussion, there's continuous updates about the interventions and what's working and what's not working and what the early results are showing. You could see, how this knowledge translation occurs, throughout the projects. And finally, it documented increasing research relevance, increases both community and academic capacities. The academic capacity building, I think, was very eloquently outlined in the discussion that happened earlier this afternoon. And in a wonderful way, produces these incredible ripple effects through the community. That one thing starts another, that starts another, that starts another. You never know what's going to come out of these projects. It's really a very exciting way to work. It's the green one.
The green one? Okay. Welcome to the territory. We hope that you're having a wonderful stay while you're here, and the sacrifice ceremonies we did to make sure that Brother Sun was out there and shining worked, and so make sure that you get some time to go out there and give thanks. And while you're here tomorrow, just about 500 steps down the road, McGill University's annual powwow will be taking place. So you can maybe zip on over after that lunch and kind of do a round dance, intertribal, and you can catch a couple of my grandsons. So it's a pleasure to have been a part of this amazing experience for the last 22 years and to collaborate in so many areas in so many ways. So we start with just placing who we are and where we are, and as the Ganyankahaga, the people of the Flint, we were established in this territory, and Kahnawake is just over there, 15 minutes if there's no traffic, an hour and a half to 2 hours if there's construction going on. We're a jam-packed community, over 7,000 residents and 13,000 acres, greatly reduced, surrounded by 2 million people. And so back home, when we say that all the 4 pots on the stove are at a steady boil, things are quiet. That's our norm. We have traditional government in place. We have band council government in place. We recognize the colonial objectives of the Indian Act, as do the people on the band council, yet they're mandated to put forth those edicts and issues, etc., and use those processes, but still at the same time thinking, and this is an important thing to remember about all of us from Kahnawake, that we think as Ganyankahaga, we think as Haudenosaunee, we think of who we are in that sovereign nationalist perspective, and you'd be hard-pressed to find anyone in the community who raises their hand and says, I'm a Canadian citizen or I'm an American citizen. Yet a lot of our behaviors and actions would have people scratching their heads. But we do what we need to do for the reasons that are important to us as a community, as families, and as individuals. There's a very flat level of authorities within the community, and so all the organizations and activities and functions are governed by different community groups, different community boards. It's not necessarily that hierarchical from band council down through to the communities as what we often see in most places. And so that has certainly been some of the important things to consider when we talk about where this project has been nested. And of course, we do have a very strong economic engine within the community from a variety of sources. And so we're a unique place. I'm going the wrong way. Okay. And it's a unique place that then was enabled us to get the Kahnawake Schools Diabetes Prevention Project off the ground and have to go back to 1985 and the late Dr. Louis T. Montour from Kahnawake and his chart review with Ann at Kahnawake Hospital and identifying diabetes as a community health issue, bringing that information back to the community, and elders telling the doctors, do something so the children don't get that. And so, we call that 7 generations thinking, and we say the face is yet to come. That's part of our role and responsibilities to ensure that those things, that those future generations are well taken care of. And so we do what we need to do at the time to best improve, make things the best way. And so the project itself is a combination of community intervention activities on multiple levels, the research that accompanies some of that at different times, and disseminating what we've learned from that within the community and to other indigenous communities and across the academy. There's all these little buttons. Okay, so as you're aware, the foundations for KSDPP come from multiple sources, and bringing these things together, talking about the importance of creating role models within the community, touches right back to our indigenous ways of doing and Haudenosaunee ways of doing that. Using the Ottawa Charter as a foundation, sent us running off into many directions with many activities, and at a time when there was 2 or 3 intervention staff people, it was barely manageable. We continue to do it today with 1.5 staff positions in place and volunteers, and the drive just continues to go to do these things, because also part of those foundations is who we are as Haudenosaunee and what's important to us. And again, that's the future generations being responsible. And it's been a process that we didn't set out to do. It's something that, upon reflection, we look back and say, "Wow, what have we done?" And this is where it came, and this is where it came from. And it was very, very humbling to realize that we were actually dancing in the way that our ancestors had put out, and that the community continues to work that way, in spite of the tidal waves of values from the different parts of the world that come into the community, and the effects of colonization and the ethno-stress that comes from that in our contemporary times. The partnerships, so we look at some of this, what are the strengths? What are the things that have made KSDPP work? It's the partnership, certainly, between the community and the academy, with respectful dialogue and relationships. Also the relationships and partnerships within the community. And I'll put a little note there that it's not always working 100% in that way, that we certainly have our own challenges within community when, say, for example, health authority is a product of that colonized way of doing things with structure and hierarchy versus a grassroots kind of thinking, and so it creates that challenge of how do we dance around that with a hierarchical power versus a flat, and how do we do that without kicking over the can and busting things, and so it requires lots of patience and lots of that inward reflection of how to go about doing that, and through the work that's been done by the partnership, we've been honored and certainly thank CIHR for the acknowledgments with the partnership and also others. In the dialogue that happens between community and the academy becomes another strength for us, and as has been stated earlier and several times, that place that we want to be of the ethical space of where the different views come to the table. We've been successful to talk through those things. And one of the things that we're always reminded of by my sister Amelia is that when students come in or when McComber's going out to talk someplace, she says, remember that the Creator gave you 2 eyes, 2 ears, and 1 mouth for a reason. And so one of the knowledges that comes from having that is that we collectively then begin to realize that we've had we've had a lot of reflection on what are Haudenosaunee research ways. How have we traditionally done that? And we then have our rich history that was put for us, our creation story, our condolence ceremony, which Amelia mentioned, with the Kahnawake, the Great Law, that gives us all the tools and the processes and ways to conduct ourselves and how we do business. And as we reflect back, we start to see that those things certainly have made an appearance, throughout the project. The success is also, the strength also comes from our way of making decisions, and it just reiterates that the dialogue takes place between the two sides. And this is modeled after a Ganyankahaga way of conducting business within the house. And that there's 3 sides to that, and that's that bringing together the dialogue, the discussion of indigenous ways of knowing and doing and topics, and the researchers looking at or coming up with the ideas of the things that may be of interest, and having that dialogue that then comes back to the community and say, this is what we've talked about, and these are the ideas, this is the idea, this is what a direction we're looking to go. What do you think? And the community then takes that and works that. And sometimes what we've gone in with has come out being something quite different than the original question, and it's that much richer from that. And so the other strength, or the last strength, at least to mention at this time, is around the building of capacity within the community, being owners, community researchers, influencing other local organizations. The number of students that have come through the project and shared then their experiences and their studies and helped us as a community to find so many different topics that we've then learned and grown from and moved that forward. And one of the things to remember about this is that we still have to work on building capacity to keep this organization going into the future, because it also requires torchbearers, people that will wave the flag and rally the troops, as it were. And sometimes we reach a point where we say, well, I just want to ride my bike. And so lastly, the Code of Research Ethics is as that landmark document that people are very familiar with. It's given us the guide, it's given us the process to move forward with and to follow with that, with going forward on there. And the policy statement is so important to remember that first we're talking about the self-determination of the Ganyankahaga. This is our ballgame, it's our life, it's our children, it's our future, and that we need to carry that responsibility for that, that the researchers will partner with that, and also that their work will be recognized and respected, and that all the research, all the work is about empowering the community. What goes back on the plate as meat and potatoes, if you will, and that becomes a challenge for many of us. And so I'll turn this over back to Anne now for just some concluding remarks, and thank you very much.